Hello and welcome to the class. I am Dr. Raghavendra S. Segde, presently working as a lecturer in the Department of Clinical Pharmacy at Hanugal Shri Kumareshwar College of Pharmacy, Bagalkot. Now, in this today's topic, let us understand about community pharmacy. The learning objectives of this session would be, upon completion of this lecture session, you should become thorough and you should be able to define what is community pharmacy. Scope of community pharmacy, which we will be covering in part 1 videos. Part 2 videos we will be seeing objectives of layout design, design of retail and wholesale stores, types of drugstore. In part 3, we'll be seeing and we'll be trying to understand what are all the legal requirements for the establishment of retail drugstore. In part 4 series, we'll be seeing and we'll be trying to understand the importance of coding and stocking. And lastly, in the last part, in part 5th, we'll be understanding the roles and the responsibilities of community pharmacist. Now, let us begin the session. Community pharmacy is any place under the direct supervision of a pharmacist where the practice of pharmacy occurs or where prescription orders are compounded and dispensed other than a hospital pharmacy or limited service pharmacy. Community pharmacy includes all those establishments that are privately owned and whose function in varying degrees is to serve society's need for both drug products and the pharmaceutical services. Now, we shall understand the scope of community pharmacy, the various scopes and of community pharmacy. The various scopes of community pharmacy, which includes in-processing prescriptions, patient care, drug monitoring services. So community pharmacy is a person for extemporaneous preparations, alternative medications, checking the symptoms of minor ailments, healthcare professions, counselors, in prophylaxis and health promotion. So these are all the 9 principles or the scope of community pharmacy, which is a very tremendous scope of community pharmacy is there in the society. Now we will see and we will try to understand one by one all this scope. In processing prescriptions, the pharmacist verifies the legality, safety and appropriateness of the prescription order. Whenever the prescription is received by the pharmacist, he checks, he verifies the legality, whether the prescription is legal or not. The first thing which comes into the mind of the community pharmacist. And he checks the safety of the prescription, the safety profile of the drug therapy, and appropriateness of the prescription order, whether the prescription order is appropriate or not. These are the first things that is said to be as in-processing prescriptions. Then later on, he checks the patient medication record before dispensing the prescription. He checks the patient, the PMR, the patient medication record, before dispensing the drug to the patient. When such records should be kept in the hospital, in the pharmacy, which is one of the important criteria. Later on, he ensures that the quantities of the medications are dispensed accurately and decides whether the medication should be handed to the patient with appropriate counseling, which is required by the pharmacist. So, he verifies and he checks the legality, safety and appropriateness of the prescription order, checks the patient medication record before dispensing the drug therapy. So, he has to maintain patient medication record and he ensures, the pharmacist ensures the quantities of the medication which are dispensed accurately. Later on, he decides whether the medication handed to the patient, whether the counseling is required by the patient. So if counseling is required, he has to counsel regarding about drug or disease. Now let us move on to the scope of community pharmacy, the second part, that is patient care. The patient care is the main objective of any healthcare professions. And the patient care can be given by the community pharmacy, which includes patient drug history, mode of administration, precautions, and advice to the patients are given by the physicians. So, whether the patient drug history, mode of administration of the medications, precautions if any required, and advice to the patients are given by the physician, no doubt about it. But the community pharmacist's responsibility is not ends over there. He has to check the patient drug history again, which mode of the administration was selected by the physician, whether it is appropriate or not. Any precautions or any advice to the patients is required in handling the preparations, in taking the prescriptions. These are the services which is very, very important. It all considers as a patient care. You are giving the patient care in the most holistic way. That is the fundamental responsibility of the community pharmacist. The third point is drug monitoring services, which is rendered by the community pharmacist. Has practiced research projects and schemes to analyze prescriptions for the monitoring of adverse drug reactions. So, no drug is safe on earth. Any drug the patient is going to take, there may be a problem of unpredictable adverse effects. So, he has to analyze the prescriptions very carefully, and he has to monitor adverse drug reactions, and he has to minimize or prevent all such unwanted effects of the drugs. Now coming to the extemporaneous preparations. The pharmacist engages in the small-scale manufacture of medicines, which must always comply with good manufacturing and distribution practice guidelines. So whenever he is preparing any medications, compounding, which should always stick to the principles of good manufacturing practices and good dispensing practices. Alternative medicines. In some countries, pharmacists supply traditional medicines and dispense, like homeopathic prescriptions, Ayurvedic prescriptions, and so on. In prophylaxis and health promotion, the pharmacist can take participated in health promotion campaigns locally and nationally on a wide range of health-related topics and particularly on drug-related topics. For example, rational use of drugs, alcohol abuse, tobacco use, discouragement of drug use during pregnancy, organic solvent abuse and poison prevention, or topics concerned with health problems. So he is a person who is involved in prophylaxis, in the prevention and health promotion. So the pharmacist is a person who is preventing and promoting the health. Okay? He is participating in various health promotions campaigns in both nation as well as the local wide. And wide range of topics, as I had said you, on drug-related topics, which may be about rational use of drugs, alcohol abuse, tobacco use, what are the adverse effects of tobacco use, what are the harmful effects of alcohol consumption, what if patient is not following the rational use of drug therapy. And the pharmacist is a person, is the first point of contact where he is telling to the patient about the harmful effects of drugs during pregnancy. And he encounters various problems and he will guide the patient regarding about the topics regarding about the poison prevention or any healthcare topics, which is a problem of concern. Checking symptoms of minor ailments is a fundamental responsibility of the community pharmacist. Pharmacists can supply a non-prescription medicines with advice to consult a medical practitioner if the symptoms persist for more than few days. Alternatively, the pharmacist may give advice without supplying medications. So, the pharmacist is checking symptoms of minor ailments, whether it may be cough, cold, or the fever or diarrhea or any kind of GI disturbances. The pharmacist is one of the member of healthcare professions, provide the information as necessary to other healthcare professions and to the patients, of course. And he always promote the use of the rational use of drugs by providing advice, explanations to the physicians and to the members of the healthcare team or to the public. The pharmacist acts like a counselor. The pharmacist provides an advisory as well as supply services to the residential homes for the elderly and other long-term patients, chronic ill patients, who are bedridden and other types of patients, who are geriatric patients. In some countries, policies are being developed under which pharmacists will visit certain categories of housebound patients to provide the counseling service that the patients would have received had been able to visit the pharmacy. So it becomes very, very important for the bedridden patients or geriatric patients. They can't come to the pharmacy. In some countries, it is happening over there, developed countries, if you take into account. This pharmacist is going to the house and is giving the service over there.